All right, as an MFM, a maternal-fetal medicine specialist, I oftentimes hear stories from my friends when they're pregnant about what's going on in their pregnancy. And I remember very vividly that I had a friend who called me up one time and said, "There's something wrong with my baby's heart." And I was very concerned and started listening. And she immediately said to me, "There's a spot in the heart." And I breathed this nice sigh of relief. And she continued to explain that it was something called an EIF. I don't know what that means. The doctor didn't explain it, and she was obviously very concerned because it was a mention of something being in the baby's heart. And so we are going to talk about the specific soft marker that my friend called me about, which is called an echogenic intracardiac focus. Welcome to the Dr. Lexi Show, where I take pregnancy topics and break them down into simple terms to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OBGYN and maternal-fetal medicine specialist, which just means a high-risk pregnancy doctor. And today we're talking about the soft marker, which is called an echogenic intracardiac focus. Now, before we get started today, I want to make sure you're aware of the free downloads. The basic download I tell everyone about, which is to help you advocate for your pregnancy, is at drlexihill.com/advocate. And in fact, if you just go to the website, www.drlexihill.com, there's a nice drop-down box at the very top toolbar that just says free downloads, and you can grab it there. The other two downloads, which are really helpful to look at or have printed off when you're watching this video, is one that is at drlexihill.com/Down syndrome, and the other one goes through talking about overall what a soft marker is in general, a little more in depth with that, and that's at drlexihill.com/soft markers. Now, if you can't remember all those or don't want to remember all of those, just go to the main website, and that's www.drlexihill.com. Toolbar at the top, free downloads, drop-down toolbar there, and you can go through that drop-down and find whatever kind of downloads you'd like. Now, we also know that I'm going to create a download that's helpful for this one, and that one is going to be /EIF. Okay, so the download for this, which we'll get into nearing the end of the video for explaining this soft marker, will be at www.drlexihill.com/EIF. Let's go ahead and dive right in and start with expanding our knowledge surrounding this topic. Now, a whole separate video dedicated to what is screening for Down syndrome and what is a soft marker. So if you want that background, go check out those videos first. If you've watched them before or you feel like you have a bit of a base for that, we're going to jump into the soft marker that is an echogenic intracardiac focus. What is a soft marker? I like to say a soft marker is an isolated ultrasound finding that's associated with an increased risk of a chromosomal abnormality, here particularly trisomy 21, which is Down syndrome. So let's break that down just a little bit. So first, it's isolated, meaning there are no other markers seen, there are no growth issues with the fetus, no structural abnormalities are noted. Next, it's an ultrasound finding. So typically these ultrasounds are done right at 18 to 20 weeks. Sometimes that range is 18 to 22 weeks. But this is particularly as it pertains to that second trimester ultrasound. And finally, increased association with a chromosomal abnormality, a type that we call aneuploidy, meaning there's an extra chromosome, and here we're talking about chromosome 21. So we call this chromosomal abnormality that an EIF is associated with trisomy 21, also known as Down syndrome. Next question here, what is an EIF? So let's break this down very simply. E stands for echogenic. Echogenic basically means it's bright white. And for an ultrasound, we want this spot that we see that is bright white. It needs to be as white as bone. So it has to be pretty bright white. Next, intracardiac. Okay, intracardiac means it's inside the heart. So somewhere inside the heart, we see this bright white, then focus we'll get to next, which is basically a spot. Okay. Most of these EIFs that we see are within the left ventricle. Some of them can be in other places. Probably about 70% are in the left ventricle, just a side note. And then the F is focus, meaning a spot. So this translates to us that an echogenic intracardiac focus means a bright white spot inside the heart. This is my most favorite thing to tell a patient. An echogenic intracardiac focus does not affect or impact or change the structure or the function of your baby's heart. And I'll say that again. An EIF does not change the structure or the function of your baby's heart. Now, it's considered mainly, as I said, it's isolated, just what we call a normal variant, meaning we're not concerned with it. Now that we know what an EIF is, let's look at some pictures. You can see there is this white spot here. Now I've zoomed in on this picture so you can't see the ribs that are surrounding this region of the fetal chest, but that spot needs to be as bright as bone. That's how with our eyes we can try to say it actually is or is not an echogenic intracardiac focus. So in this view here, just to orient you if you're looking at this, this is the right side of the heart, this is the left side of the heart, this is the top portion of the heart, and the bottom portion of the heart. So this would be what we call the right ventricle, this would be what we call the left ventricle, and right here is that spot. Now that you know the spot needs to be as bright as bone, the other interesting thing is we need to see it in two planes. So this on the right-hand side here, this is a view of what we call the four-chamber heart. Now I've flipped these images because this is how we see them when we're scanning oftentimes. Right side of the heart over here, left side of the heart over here, right ventricle, left ventricle, right atrium, left atrium. So we have this spot here in the left ventricle. Now, an ultrasonographer that's doing the ultrasound would also then try to turn their ultrasound probe and get this view over here on the left. We call this the left ventricular outflow tract. So this right here is the left ventricle, and this is where the aorta is leaving that left ventricle. And you can see this spot right here. So what happens sometimes is we think we may see a spot over here when we're looking at that four-chamber view, and then we turn on it, not as bright, we don't see it. It's not technically considered an echogenic intracardiac focus if we don't see it in these two planes. So I have this video here because I've explained what an EIF is as far as the words, but where does it come from? And so we typically think that these are little microcalcifications in the papillary muscles. And the way I explain this is the left ventricle, and this is that spot we see. And very small muscles down here called the papillary muscles help this valve here, which is the mitral valve, to open and close. So as I hit play, you can see as this valve here is moving, this EIF is moving because the EIF is basically considered these microcalcifications of the tiny muscles that are down here in the left ventricle that are helping this mitral valve to open and close. And that's it. An EIF is thought to be these microcalcification of those papillary muscles. Now, the question gets into this now. How does an isolated EIF change the risk of Down syndrome? Well, the answer to this is it depends. So if you're someone who has a pregnancy right now and there's an EIF that's noted, there's two basic scenarios I want to go through with you. Scenario number one. Now, this is one of the downloads. This is the download that is listed as soft markers. In the prior video I've done on soft markers, I go through how associated a soft marker is with this chromosomal abnormality risk, which is trisomy 21. An echogenic intracardiac focus is only mildly associated. We'll go down the left side of this flow sheet, and you can see in the top left-hand corner here, scenario number one. Let's say you already had a blood test that was low risk for Down syndrome. Whatever test, there's many different options, but let's say any blood test that you had done to check for the risks of Down syndrome in this pregnancy, that it returned low risk. And you have what's circled in yellow, a mild soft marker, this echogenic intracardiac focus. Then we are looking right here. If you have had any prior blood test that was low risk, there is no further workup for Down syndrome that's recommended. Okay? Considered a normal variant, that's it. In fact, if the type of blood test that you had performed was cell-free DNA screening, then you could probably say that your risk of this fetus having Down syndrome is approximately less than 1 in 50,000. So if you look at the separate video on Down syndrome screening, you can really learn more about cell-free DNA screening how it's performed, and what the results mean. Let's go to scenario 2. Again, we're looking at the left-hand side of this flow sheet. What's circled in yellow, we have a mild soft marker, meaning it's mildly associated with Down syndrome. And let's say this scenario 2, you have not yet had a blood test done to screen for your risk of Down syndrome. All right, then you fall into this checkbox category here. If no prior blood test, discuss your option for cell-free DNA screening. And I put there AKA non-invasive prenatal testing. We call it a bunch of different things. The point here is that if you haven't had blood testing, then what is your risk of Down syndrome right now before you have any blood testing? And that's what I'm going to dive into right here for you, okay? So without prior blood testing, we can try to estimate your risk of Down syndrome. And I put this here to show you that this soft marker, an EIF, how associated is it with Down syndrome? Mildly. Well, how mildly, if you're asking? I got you, okay? The exact association is considered to be about 0.95 to 1.8. That number I'm listing there is called a likelihood ratio. Don't worry about all the statistics behind that. I'm going to explain to you clinically why that is important. So let's take that information. So when an ultrasound shows an isolated EIF and you have not had any blood testing done for Down syndrome screening, what we do is we can look at your age-based risk of Down syndrome. And then we can take that number I mentioned before, that likelihood ratio, do a little bit of math, and come up with a new number that tells us what your quoted risk of Down syndrome is after seeing this finding of an isolated echogenic intracardiac focus. So these quoted risks are based upon your age to start with, and then we do the math thereafter. So I have a nice table here for those who are age 20, let's say. Your age-based risk of having a child with Down syndrome is approximately 1 in 1,250. All right? And then let's say, okay, then you had this ultrasound performed and now you have a risk. I'm going to use this risk here, 1.8, the likelihood ratio that is talking about how I can calculate your risk, taking it from your age-based risk and now giving you a new risk based on this likelihood ratio. And when I do that, I can now say to you, the risk of this fetus roughly having trisomy 21 is approximately now 1 in 695. You went from a risk when you walked into the door of being 20 years of age that I could say your quoted risk, and remember, this is you have had no blood testing done. The risk of Down syndrome is approximately 0.08%. Now that I see an isolated echogenic intracardiac focus, I would say that your risk is approximately 0.14%. So this person who's 20 years of age with an isolated EIF has gone from a risk of less than 1% to still less than 1%. That holds true for the 25-year-old, the 30-year-old, the 35-year-old. However, when we hit 40, we start to really see that our risk, even when we walked in the door, is right around 1%, and now is increased to approximately 2%. You may be asking yourself why the change with the age. Well, it deals with what we call the prevalence of Down syndrome, and that increases as we increase in age. All right, now that we've gone through those two scenarios, and hopefully you've been able to figure out which scenario you fall into, and that was for expanding our knowledge surrounding an EIF. Now let's jump into developing some skills. This is the download, and everything I try to do for developing skills should kind of be themed in purple. So you can see there's this nice box here on developing skills. There's some general questions to start with asking your provider about. Can we discuss what this ultrasound finding means? Can we review any blood tests I've already had done or any that are recommended? And then does this finding need any other workup or any further ultrasounds? I'm going to help you answer some of those questions right now. This is where, if you haven't already, make sure to check out the download that is about EIF. So drlexihill.com/EIF, or go to the website, look at the drop-down box for free downloads. This is what the download looks like, and we're going to jump into it and break it down a little bit. Expanding your knowledge. There are 5 things I want you to learn from this or take home from knowing and learning about an echogenic intracardiac focus. First thing, when an ultrasound shows an isolated finding, meaning it's the only thing seen on ultrasound, that is called an echogenic intracardiac focus, be aware that this is a soft marker for a chromosomal abnormality called trisomy 21, also known as Down syndrome. Second thing, of the soft markers, it is low on the list of concern for trisomy 21 or Down syndrome. Next, when someone has had screening that returned low risk, no other screening test is recommended to evaluate for Down syndrome. Remember, this is when this EIF is isolated. Thing number 4 I want you to think about here and really make sure that you kind of understand, this is not a soft marker that is associated with other issues. When you have had blood testing that returned low risk for Down syndrome, this is considered what we call just a normal variant. And thing number 5 here, follow-up ultrasound is typically not recommended. Feel free to ask your provider if you need a follow-up ultrasound. You may have other things going on in the pregnancy, high blood pressure, diabetes, history of a growth-restricted fetus, all kinds of other things. For just this finding alone, there isn't a need for a follow-up ultrasound. Again, don't forget though, you may have other reasons to have a follow-up ultrasound. Maybe they didn't see all the anatomy they wanted to see on their ultrasound the day they saw this EIF. So do make sure to ask your provider, particularly for your individualized care, if you need some follow-up ultrasounds. The second portion of this handout, which I love for really helping you to develop some skills, I break it down into 2 parts here. First, as the patient, what are some things that you need to know? The first thing here, know if you had any blood tests performed to screen for the risk of Down syndrome. Second, ask for genetic consultation if you want to have more information about an EIF. Then what are some specific questions to ask your provider? We kind of went over this before, but this is on the handout, so you really have the ability to advocate for yourself and know the way in which to ask the question. First one there, did I have a blood test performed called cell-free DNA screening? Next one, can we review the results of any blood test I had performed that was screening for trisomy 21, which is Down syndrome? And finally, you can ask this question. I know that invasive diagnostic testing like an amniocentesis is an option for all patients. Is this something that we can discuss? Now, the finding of an EIF is not an indication by itself, remember when it's isolated, for necessarily an amniocentesis or some type of diagnostic invasive testing. However, every patient in every pregnancy has the option of having an amniocentesis performed. And you may be asking, why is that? Well, we are talking here about soft markers that have an increased association, this one particularly with Down syndrome. Now, there are so many other chromosomal abnormalities that cannot be assessed by the blood test that we're talking about for Down syndrome. So we have to be aware that about 1 in 300, roughly, specifically more like 1 in 270, pregnancies can be affected by some type of rare chromosomal abnormality. So if you are someone who wants to know more about all the chromosomes and really look more into the genetic components of the fetus, that is a discussion to have with your provider, a discussion to have with a genetic counselor, and you always have the option to proceed with invasive diagnostic testing regardless of any finding of a soft marker. All right, let's recap a couple of things about an echogenic intracardiac focus. First thing, what is it? It is a little white spot that is in the heart. Remember, echogenic, white, intracardiac, inside the heart, focus, spot. A little white spot in the heart. Next thing, if you have it, think about your scenarios. Scenario number 1, you had blood testing done, low risk for Down syndrome, considered a normal variant. Scenario 2, you have had no blood testing done yet. You can calculate some risks and talk to your provider about having a blood test done to screen for your risks of Down syndrome. And then thing number 3, what I'd like to point out too is if you do have a finding of an echogenic intracardiac focus or any soft marker, it means you should be getting a detailed anatomy ultrasound. So feel free to talk to your provider and ask them if that's what you're getting when you're having that ultrasound performed. I hope today was informative with regard to echogenic intracardiac foci. I hope you were able to really expand your knowledge about what it is, develop some skills on the questions to ask, and knowing the tests a little bit more, a little bit of the verbiage around it. And again, the final part of what I really want to do is have an impact on you, your pregnancy, the pregnancy of those friends of yours that may have questions and not know where to go. This is the place I hope that they can really find some answers so that they can have a positive impact on their pregnancy and of the lives of those around them. Don't forget to follow on YouTube, Spotify. I have a podcast on there so you can listen to stories of pregnant individuals and different doctors that really are going about helping pregnant individuals, as well as people like doulas, nurse midwives, all kinds of healthcare providers in that space of trying to help pregnant individuals advocate for their pregnancies. Hope you enjoyed today's video, and as always, I'm Dr. Lexi, wishing you a happy and healthy pregnancy.